Good morning, friends. In the last class, we are discussing about nocturnal enuresis with special reference to Shayya mutra in Ayurveda. And we have already covered the theoretical part of the same. In this part 2, we will continue with the possible pathogenesis of the nocturnal enuresis followed by Ayurvedic management. The possible pathogenesis so far in case of Shayya mutra is delayed maturation of the cortical mechanism that allow the voluntary control of the micturition reflex. There is some problem with the cortical mechanism, and the maturation of the cortical mechanism is delayed due to various factors, and this is allowing the voluntary control of the micturition reflex. Second possibility is about the sleep disorders. Enuretic children are normally considered as deep sleepers, and enuresis can occur at any age, at any stage of the sleep. So it is also quite sure that enuresis has got the pathology of the enuresis has got some relationship with the sleep. Similarly, reduced antidiuretic hormone secretion at night. Something is happening so that at night there is reduced antidiuretic hormone secretion, and because of which the water retention is less as there is no antidiuretic hormone, and that is allowing the formation of more urine, that is quantity of the urine, and forcing the baby to go for micturition. Fourth point is genetically we have seen that certain of the chromosomes like 12 chromosome number 13q is likely to be affected, as this is showing a very strong genetic predisposition in the form of autosomal dominant fashion. Paroxysmal nocturnal enuresis is a disorder of arousal. The problem is child is not able to get aroused or wake up during the micturition call. Therefore, it involuntarily passes in the bed. So, bed wetting occurs generally at the stage 4 of the sleep, and usually it is preceded by increase in the body movement and increase in the muscle tone. In the stage 4 of the sleep, there will be burst of the delta waves, and patient or child goes to the stage 4 day sleep or REM sleep. If he is aroused at this stage, the patient cannot interpret the sleep dreams. So patient go back to the sleep. So has the normal sleep rest of the night. If he is not aroused, he will go to the has no stage 3 and stage 4 sleep. Later report of dreaming of wetting. Now, when we consider the same in terms of pathologies, in terms of Ayurveda, these are all in the previous slide we have explained the possible pathologies from the contemporary science. Now, if we consider the pathology in Ayurveda for Shayya mutra, it is quite obvious that two important Vayu Dushtis will be seen. Prana and Apana Vayu Dushti will be there. There is also involvement of some of the Karmendriyas, especially Upastha, Vak, Pani, Pada, Payu, Upastha. So less formation of the Vata in children, we know that. Vata itself is immature in children. That's what Kashyapa says. Vata Dyoho Vinaha. That means all the Vatas are not, Vata the doshas, three doshas are not completely manifested in children. Therefore, it is not showing all the signs and symptoms of Vata Vriddhi, Vata Kshaya or whatever, Vata Prakopa, etc. Therefore, assessment of the disease in children is quite difficult. Therefore, he says, Bishak Komar Vrityaste Karanam Nitya Dukkitaha. So there is a sort of immaturity existing in the organ system or functional integrity. Relation of the mind and its relationship with Raja, also we know that. Raja will going to increase by Vata Guna and Raja will going to decrease by the Vata. There is a interrelation between this Raja and Vata. Increase in the Raja also leads to the increase in the Vata and vice versa. So there is some sort of fluctuation of the mind. If I say the Vata Vriddhi is there or Vata Kshaya is there, there has got some relationship with the Raja also. Rajaha Pravartaka. Raja is related with the fluctuation of the mind. At night hours, predominantly during Vata dominant Kala. In the night hours, if you divide the night hours, the 12 hours into the Vataja, Pittaja, Kaphaja Kala. So at night hours, during Vata dominant Kala, so this do happens. So most of the cases of nocturnal enuresis are reported in the Vata dominant Kala, 2 am onwards. So therefore, the chance of immature Vata showing fluctuation in its quality is quite obvious. The incidents are also more in Vataja Prakriti child. It is also observed in Vataja Prakriti child. Also, the incidence of the Shayya mutra is more. Functions of the Apanavata, if you see, Apanavata is directly related with the function of mutra voiding of the mutra. Now, even the Apanavata is also immature in this condition. So, Apanavata is not able to control the mutra, or Apanavata is not able to regularize the flow of the mutra. There is sudden excitement and sudden opening of the sphincters that leads to passing of the urine in the bed. Now, in case of primary enuresis, where family history has been considered as the main cause and some other structural and congenital problems are considered to be the main cause, the primary enuresis can be considered to the Margavarodajanya pathology. Okay. Or there may be structural and congenital problems can be considered as some of the existing kavai gunya in the urinary tract or in the nervous system. Whereas secondary enuresis is mediated by the rajaguna, vitiation or fluctuation of the mind leading to vata vriddhi or vata prakopa and leading to enuresis. Exactly, we cannot say it is vata prakopa. It is a sort of immaturity of the vata. Vata is not able to regularize the things. So, complicated form of enuresis can be taken as Vyadijanya Shayya mutra. Now, if you see the causes of enuresis, this we have seen previously also, but in a detailed way, if you see the causes of enuresis, these are the common causes of enuresis: obstructive sleep apnea, constipation, cystitis, diabetes insipidus, diabetes mellitus, idiopathic, genetic, psychological, overactive bladder, dysfunctional voiding, neurogenic bladder, ectopic ureter, posterior urethral valve, disorders of the sleep arousal, nocturnal polyuria, and low nocturnal bladder capacity. All these are considered as causes of enuresis. So when you are dealing with the child of enuresis, you have to inquire all these points. If you miss, it may be a simple symptomatic treatment. But if you go by causes, then you can find out the cause and you can treat the cause. And these are the commonest causes of enuresis. Now, causes of enuresis, children have their other causes, like sometimes the enuresis is common in children because they have got some other causes like irregular drinking habits or caffeinated drinks, improper toilet training, worm infestations, bullying, as I explained earlier, psychological trauma, sexual harassments, child abuses, and child exploitation. Usually, by 10 to 14 years, they come out of all such conditions or this condition. However, if it is continued after 10 or 14 years also, then it needs to be investigated. There may be other causes like absence seizure, which is responsible for 3 to 4 times of urine passage at bed in night. Suppose a baby is suffering from an absence seizure. It is one of the convulsive disorder, absence seizure. Even in the absence seizure also, baby passes urine involuntarily. Now, a parent who don't know about this factor, it is simply considered as Shayya mutra or bedwetting. But actually, the child is suffering some primary problem in the brain because of which there is a seizure, and every night the seizure is coming, and as a part of the seizure, child is passing urine, and parents are mistaken it as a simple Shayya mutra, and physician not inquired, he also misses the same. Now, one of the most important cause of Shayya mutra in children is obstructive sleep apnea. What do you mean by obstructive sleep apnea? There will be decreased. Obstructive sleep apnea means suddenly there is cessation of the respiration and the child get up from the sleep suddenly. Okay. Usually this is common in those patients who are obese, children who are obese, or with adenoids, with the deviated nasal septum, and some other tonsillitis like problems, enlarged tonsils. So usually obstructive sleep apnea is common in those. Of course, sometimes it is also having familial tendency. Now, what actually happens here is, in case of obstructive sleep apnea, there will be decreased antidiuretic hormone and there will be increased levels of ANP. ANP refers to arterial natriuretic peptides. This increases the urine production and causes the nocturnal enuresis, which is called as nocturnal polyuria. The common cause of obstructive sleep apnea are large tonsils, as I explained earlier, large tonsils and the adenoids. This will lead to the same problem. In elderly, snoring is one of the main cause of bedwetting. Suppose a 10 or 15-year-old child is going to having the complaints of bedwetting, then snoring usually happens in deep sleep. Okay, so snoring is one of the main cause of bedwetting. Tongue falls back and there is no enough oxygen supply to the brain, and this causes inhibition of the brain over the bladder, which leads to passing of the urine. So this is how an obstructive sleep apnea can cause nocturnal enuresis. What happens is there is a snoring, and because of the snoring the tongue falls back, so it leads to less oxygen supplies to the brain cells, and this interfere with the brain function, and there is inhibition of the brain over the bladder is get now less, that means loosened, okay, and decreased, and this leads to passing of the urine. Now brain is not able to completely control the bladder function because of as it is receiving less oxygen. Another important cause for the bedwetting is constipation. Most of the time this is neglected, and this will lead to restriction of the bladder capacity. When the colon is loaded with the stool, it put pressure over the bladder and the bladder capacity will be reduced. The increased colonic movement, usually in case of constipation, there is also increased colonic movement at night, and this will going to trigger the destressor muscle action, and as a result, or destressor muscle contraction, and as a result there will be passing of the urine at night. Another important cause of nocturnal enuresis is cystitis. Cystitis is inflammation of the urinary tract. This is diagnosed by the history, urine analysis, and also urine culture if you go in detail. And there will be urgency. Usually the child is present with the urgency of urination. In this condition, there will be urgency of urination and increased frequency. The thing is, if it is cystitis, child may also have daytime incontinence. Not only nighttime incontinence, even the daytime incontinence may be also there. Okay, that's how you have to differentiate. This is also common with the Urge syndrome, dysfunctional voiding, neurological bladder, urethral obstruction, ectopic ureter, and diabetes mellitus like condition. Also you find urgency of urination will be there. So there's too much of urgency. Because of urgency, child is not able to reach the bathroom and the child will wet the napkins. Same urgency will be also seen in these conditions also, like Urge syndrome, dysfunctional voiding, neurological bladder, urethral obstruction, ectopic ureter, diabetes mellitus, etc. Now another condition is ectopic ureter. Incontinence occurs when it is inserted distal to the external urethral sphincter. The insertion of ureter in the bladder, it is ectopic. Okay, so when instead of the normal position, when it is inserted distal to the external urethral sphincter, so this may be possible. Usually this problem, that is enuresis due to ectopic ureter, is most commonly seen in girls. Okay, boys are usually continent, and the child will wet both day and night. Again, these are the conditions where child may be wetting the pants both day and night, because this condition is existing there permanently. Daytime frequency syndrome. This is common in boys. This is common in the boys with elementary school age, and often it is of sudden onset. It is often with the frequent voiding every 5 to 10 minutes. Daytime frequency occurs in 25% of the children and causes viral or chemical cystourethritis. Sometimes even the emotional stress may be also cause of daytime frequency syndrome. Another important cause which is considered in Shayya mutra is nocturnal polyuria. Nocturnal means night, polyuria means passing of excess urine. That is, urine's production is greater than 130% of the child's expected bladder capacity. Yes, that's the problem. Expected bladder capacity is there. Expected bladder capacity is 30 ml plus age in years into 30 ml. Okay, 30 ml plus age in years into 30 ml. This is the expected bladder capacity. And sometimes because of some problems, there will be more production of the urine than the expectation, 130% more. Okay, So excess nocturnal or evening fluid intake and solute intake are the major causes. Child is taking the fluid after 8 o'clock in the evening, okay, after 6 o'clock, 7 o'clock, or even at night hours. Child is taking excess fluids, and usually the child passes extra nocturnal diuresis. So excess nocturnal and evening fluid intake and solute intake is one of the major causes. Even the sleep disorders, breathing problems, heart problems, and metabolic conditions may also contribute the same. Factors which cause a nocturnal enuresis are nocturnal polyuria means babies wetting the whole bed sheet. Okay, sometimes baby is passing the urine, but it is in very scanty amount. Sometimes baby is passing the urine, but whole bed sheet is wet. That is polyuria condition, because baby is passing extra amount of the urine. More urine itself is formed. Okay, so fluid. What are the major causes? Factors which influence this is fluid ingestion in the evening hours before bedtime. Okay, so eating in the evening hour before bedtime, then low nocturnal secretion of antidiuretic hormone. Something is happening so that antidiuretic hormone is produced in less amount during night hours. In daytime it is produced normally. In night hours it is produced in less amount. Okay, increased nocturnal solute secretion is also one of the causes. So keep the child well hydrated at daytime and restrict the fluid at evening hours. How to manage this? After 6 o'clock, don't give any fluids. But in the daytime, give good amount of the fluids so that the hydration of the child will be maintained. But after 6 o'clock, restrict the fluid. You can give at 6 o'clock so that by 8 o'clock baby passes the urine and go into sleep. And don't give any fluids at 10 o'clock, 11 o'clock or 9 o'clock, etc. One more major cause which causes passing of urine in the bed at night hours is diabetes mellitus. Diabetes is another condition where there will be nocturnal enuresis. However, the enuresis is not present symptom of new onset of diabetes mellitus. Okay, if the diabetes mellitus, juvenile diabetes mellitus of new onset, there may not be enuresis. But in the established diabetes mellitus of juvenile origin, there may be the passing of the urine. We know that in case of diabetes, there will be always, because of the change in the osmolality and all those things, the urgency of passing of the urine is there. So in children with already having a tendency towards nocturnal enuresis may be precipitated by this condition. Urine investigations of the patient should be done. We can know how much urine present and all those things. If the glucose is present, then we have to go for the full investigation of diabetes mellitus and treatment has to be followed. Another condition which may lead to nocturnal enuresis is diabetes insipidus. Diabetes insipidus is also a very rare condition, but it is also one of the cause of enuresis. Go for the morning urine sample analysis to assess the capacity of the urine to concentrate the urine by looking at the specific gravity of the urine. So if you are suspecting about diabetes insipidus, go for the estimation of specific gravity of the urine by collecting morning sample of the urine. If it is less than 1.105, it suggests that specific gravity of the urine is less, and this may be a case of diabetes insipidus. We know that antidiuretic hormone will be blocked or it is producing a less amount due to various situations, so that water retention which is taking place in the collecting tubules of the nephron is not possible, and as a result the water is going out, and that leads to diabetes insipidus. Now there are some disorders of sleep arousal causing nocturnal enuresis. Sleep arousal means child is not able to wake up during the micturition call. So whenever we get a micturition call, that means when the urinary bladder is get distended, and because of the mechanical stimulation, so we will have a urge to pass the urine, and immediately we will get up. The problem with this nocturnal enuretic child is he is not able to get up when there is a micturition reflex. Okay, so child will have problem with arousal. Arousal of the full or contractile bladder involves certain anatomical areas of cerebellum. That means this arousal technique or reflex is actually mediated by the cerebellum, some anatomical areas of the cerebellum. Even the reticular activating system is also involved in this. Reticular activating system, which connects the basal ganglion area to the cerebral cortex in between. So during the sleep, this reticular activating system will be taking rest. Okay, so therefore there is no passing of the sensations and motor signals, etc. So even this is also considered to be involved in this particular pathology. Even locus coeruleus is of one of the part of the brain that is also very important for arousal technique. Pontine micturition center also controls the contraction of the distressor muscles, hypothalamus, spinal cord, bladder. Everything is important. So sleep arousal, when I say problem related to sleep arousal, cerebellum, reticular activating system, then other parts like pontine micturition center, hypothalamus, spinal cord, bladder, everything is get involved. The neurotransmitter involved in the control of urination are noradrenaline, serotonin, and as well as antidiuretic hormone. That we know that. The neurotransmitters which are involved in all this neurological process is neurological process of the formation of the urine and excretion of the urine is nothing but noradrenaline, serotonin, and antidiuretic hormone. ADH prevents the enuresis by decreasing the urine production and facilitates the arousal. Now this is very important. If the ADH is produced in a normal amount, then it decreases the urine production naturally, and also it facilitates the arousal. It also makes the child to arouse from the sleep. And in case of this problem, ADH is not completely produced or not properly produced. Okay, so there will be problem. And during this, if this is the cause, then alarm is ringing, but child is not. So this is what actually happens here. If there is antidiuretic hormone is less, alarm is ringing. We have kept the alarm to wake up the baby at 2 o'clock. Alarm is ringing, but child is not waking up, because if the problem is because of less secretion of ADH, this may happen. Okay, children with enuresis usually do not wake up normally by auditory signals. This is what is found. Auditory signals, usually children will not wake up. Okay, during enuresis, we have to follow some other method, tactile stimulus, like that. Another condition which leads to Shayya mutra is small nocturnal bladder capacity. Capacity of the bladder itself is less. Distressor muscle contract at a lower volume rate at night hours. This causes the spontaneous bladder contraction. When the bladder contracts, naturally the sphincters will going to open. The activity of the external urethral sphincter falls below a critical level during the sleep and triggers the distressor contraction. Deficiency of inhibitory control over the bladder is an essential autonomic function. So prostaglandin E2 also affects the distressor tone and might be involved in nocturnal enuresis. These are the problems. So whenever child comes with a Shayya mutra, we have to also think that this may be simply because of small nocturnal bladder capacity. Therefore, baby is having urgency and baby is passing. The bladder capacity itself is decreased due to various causes, or early contraction of the distressor muscles of the bladder, and that is forcing the sphincters to get open, and that leads to passing of the urine. Why I am telling all these things is in each conditions we are identifying the cause. Once you identify the cause for nocturnal enuresis, then Ayurvedic treatment will be very easy and accurate. Without understanding the cause, if you treat, it may be a generalized treatment. It may not be a gunshot treatment. Another important thing is voiding dysfunction. Few of the babies will have voiding dysfunction. Normally, usually bladder is filled with the urine and it is stored. Later the smooth muscles contract and the sphincter will relax and the urine is get passed. This is what is normally happening. Abnormally, in some babies what happens, sometimes bladder muscle becomes hyperactive. Okay, and when there is little urine also, now the child gets the urge to go for the urine with the little urine. Sometimes the child is contracting the bladder smooth muscles. Child's bladder smooth muscles are contracting, and same time there is also contraction of the sphincter also. So this should not happen. So there is a balance between sympathetic function and as well as parasympathetic function always. But sometimes what happens, the bladder distressor muscles are also contracting. In the meantime, the sphincters are also closed. So urine is not coming out. So what happens in such condition? Urine is not coming out. There is no way out to come out. So bladder is contracting as closed, empty and partially filled bladder. Bladder is simply contracting and urine itself is very less. Okay, urine is also not full in the bladder, but still it is contracting as a closed chamber. So usually fecal incontinence achieved earlier than the urinary incontinence. Now this is also observed. Therefore, child going to achieve the fecal incontinence earlier compared to urinary incontinence. Okay, fecal incontinence comes earlier compared to urinary incontinence. Another condition which may lead to enuresis is overactive bladder or dysfunctional voiding. Same. Now this is more common in girls. Overactive bladder is more common in girls, especially elementary and school age. This will be characterized by urinary frequency increased, urgency increased, squatting behavior will be there, squatting behavior will be there, daytime wetting will be also there, and there is also enuresis at night hours. So ask for the habit of withholding the urine for a long time. This is what is Vegadharana, mutra Vegadharana, as explained in Ayurveda. You have to ask for the if the usually girls used to have this withholding of the urine due to various causes. Okay, so therefore this is quite common in the girls. So also common in kids with ADHD. Those kids with ADHD, they also do have overactive bladder, and it is also caused by the vesico-urethral reflex, UTI and constipation, etc. Now in case of overactive bladder, child is not passing properly, and that leads to various problems, and child may pass the urine at night hours when it is relaxed. One more important condition is a neurological bladder, neurogenic bladder. Okay, so this can occur due to a lesion at the spinal cord, maybe in the cerebrum, maybe in the peripheral nerves. Okay, in the spinal cord, especially meningomyocele, tethered cord tumors, and spinal cord trauma, etc. may lead to this. Similarly, problem related to cerebellum also causes neurogenic bladder. Peripheral nerves also causes neurogenic bladder. Everything which is related with the nervous connections which are related with the bladder may cause this. Okay, the other causes are if the pelvic surgery, history of pelvic surgery, radiation therapy for pelvic malignancy, then pelvic fractures, incontinence surgery, sacral agenesis, imperforate anus, okay, lumbosacral. Now these are the other causes of neurogenic bladder. Now what actually happens is anal wink, a tight skin around the anus which contract the bladder muscles. This is also a cause, anal wink. Ask the patient to stand on the toes, and this will help to assess the integrity of the S2 and S4. If she is able to do so, then integrity is good, and if she is not able to do so, then S2, S4 integrity is not good, and there may be some problem in that particular area, and that is the cause of neurogenic bladder and also enuresis. One more condition which may lead to this abnormal urine passing at the night hours, that is urethral obstruction. It can be congenital sometime. Sometime it may be because of posterior urethral wear causing the obstruction. Congenital strictures may be the cause. Urethral diverticulum may be the cause. It may be acquired as a result of infection, trauma, or stricture. Sometimes meatal stenosis may also cause this. In all these conditions, what happens is the urine is not properly passed, and it will be stored in the urethral. And at night hours, when the child is relaxed, during the night, it passes out. Emotional factors are also one of the basic factors, or it should not be missed in case of Shayya mutra. Parental stress itself is one of the basic cause. Parents are confused, parents are stressed, parents are anxiety. By looking at the parents, child will get confused and develop the psychological stress, and that itself leads to this problem. Every parent would have been experienced this many times. Parent separation anxiety. Okay, so mother is not with the child is crying for mother, parents, or father crying for the father is working somewhere else. So this separation anxiety may also lead to psychological disturbance, and it may lead to nocturnal enuresis. Change in the residence, we have seen this, and school difficulties also we have discussed before. Now we go for clinical understanding. What are the common questions during the interrogation with the child or patients? So with this, we complete the second part of Shayya mutra. In the next class, we will consider the clinical understanding. That is, what are all the common questions during interrogation with the child and parents, clinically in the OPD basis or OPD setup or IPD setup, when we inquire a enuresis child, and we are also with the parents are also there as a unit. And so when we interrogate, what are the common questions asked and what are the solutions for that? Okay, what are the common questions asked by the parents and what is the solution for that? So that we will discuss in the next class along with the Ayurvedic understanding. Thank you very much.